All right, image evaluation practice, and I do have another whole presentation for image critique. Now, do I understand we have another meet on this, another lecture Tuesday? Here, all right. Okay, Lillian, what are we looking at? Talk it out.
Well, the shoulder is in the center of the image, so I'm assuming a shoulder joint, maybe. And I mean, I think it meets image criteria because the humerus is pulled out of the way.
Okay, you said you think it's a shoulder, okay? A shoulder joint, and the arm is where?
Way.
The arm is this. Do we do shoulders this way?
Oh no.
Again, follow the humerus on out. Do your arm, do it like that. I mean, we know it's going that far out. Do we do that for any shoulder? I'm kind of going towards a,
Scapula.
what scapula?
Scapula. No.
What was this? What do we see here? Half a chest. Look at the whole picture. Don't just look at the arm.
So this is it.
Here's the coracoid. Crosshair it.
AP scapula?
AP scapula, does it meet criteria? What's clipped?
The inferior.
Inferior angle. Look how much space you got up here. So you were doing good, but you're jumping too quick to a conclusion. Look at your arm first, then look at the central ray. The central ray would have been the giveaway. Because, I mean, there's your coracoid right there, and we know it's 2 inches down. Well, it's dead center of the what? The scapula, so we know it's something to do with the scapula. I don't see a Y. I see a half a chest. So we had to do that obliteration of lung markings. Does this kind of make sense to you? All right. All right. Let's see. Miss Morris, let's go. Yeah.
That's going to be an internal rotation.
What's the image of?
AP shoulder.
AP shoulder. Okay, I'm with you.
There's a greater overlap of the humerus head over the glenoid cavity. The lesser is going to be pointing medially. Yes.
So which rotation are you looking at?
Internal. Internal.
Internal is going to give you that triangular of the lesser. Remember to show triangular. This is your lesser right here. It's way away right now. This is your what?
Greater.
Greater. How do you see the greater? External. All right. Position of the hand.
External.
Okay, thumb pushing out. All right. Relationship of the humeral epicondyles to the plane of the IR. They're parallel. How many questions we had off of that? About 5. Are you okay with this? You just trying to find it on that little chart.
I was trying to compare it.
We'll find it. So I'll give you see it now. All right. You good? Here's your two greater and lesser tubercles right here. And this greater is pushed out. It's got that big rounded side to it. Are you okay? Is everybody okay?
The difference between this picture and the one in our book is
Yeah,
that this one is over the glenoid cavity more than the one in our book.
Okay.
That's why I'm confused. That's why I thought it was internal.
Yeah. Always go with your tubercles. Yeah. Because the one that has the greater overlap is your neutral.
It's the
Is it the neutral? Is it what?
internal.
Internal. Because this definitely it shows a lot of humeral overlap. So just keep this in mind. Every x-ray is not going to look identical to your book. So go with everything that you know. And again, I would have went with these two over here. And that definitely is pushed out and rounded off. I always think the greater is that got that great big hump over here on this side. You good now? Okay. All right, image critique. Tessa, thanks for volunteering. Let's go. What is the projection? It is an AP projection of? What are you looking at?
My iPad at the image. With you.
Okay, I didn't know I could do that. Oh, cool. It's the only thing in the picture, right? It's got that long, collimated, and we see the articular ends. Now, which is it? Is it straight or is it an axial?
It's straight.
It's straight because it does have this little bit of bend down curve right there. Yes, everybody see that? What's the respiration? It's the one unique thing about this particular projection. Somebody want to help her? It's what? Expiration. Remember, that was the only one they said exhale. All the others are what? Inhale. Yeah. All right. Hannah Dowden. What we got?
We have an AP clavicle with angulation because the clavicle is horizontal and barely has any real.
Very good. And you see, real pretty, you see the articular ends on this one, really pretty. Very good, very good. Everybody hear? Everybody got that? Let's see. Okay, so what is the central ray? Let's see, what is the central ray if the patient was standing lordotic?
It would be mid clavicle, 2 inches above the cord root process.
It's mid shaft. What's the angulation if the patient is lordotic?
If the patient's in the lordotic position, 0 to 15.
Okay, what if the patient is not in lordotic and they're standing?
30.
What if they're supine?
It would still be 15 to 30.
15 to what?
30.
30, yeah. All right. All right. Thinner patients require more or less? More. Very good. All right. Ms. Shelton, let's go.
This is shoulder.
Here's your what? Okay, look, I'm crosshairing right about there, about an inch below the what? So that tells me it's a shoulder, okay, and rotation?
Internal.
Internal rotation, and let's see, the relationship of the humeral epicondyles.
Perpendicular.
Perpendicular, very good. All right. Hard one, hard one, hard one. Presley, you're welcome.
This is
Projection.
a lateral scapula. No.
What's in the middle? Crosshair it. What part of the humerus? Do you see the whole humerus or do you see a half a humerus? Did you say the whole?
Just that.
Okay, we see the proximal half of the humerus being demonstrated through the chest cavity known as the thorax. It's black around it. Humeral head, we're right at the surgical neck. So what's it called? What's the projection? I just gave it to you. Transthoracic lateral method. The Lawrence, very good. Yep. And why would we be doing this? Just because? Transthoracics are very hard to do. And we only do them when the patient has what? Known trauma to the affected arm. This is the affected arm. So we're not going to let them do what? They're not going to be lifting and moving and doing anything with this arm. So we have to what? Keep it stabilized, shooting through this side, transthoracic. You sure? Don't just say gotcha just to get me on moving on, because I won't. Do you see a transthoracic now? Do you see a lateral chest x-ray, the top part of a lateral chest x-ray? See the black lung fields? All this is lung, right? And this is the humeral head. Remember what I told you to do. Crosshair, it hits right there, about right there. So you have to think about that. What hits at the surgical neck? That's the only one that hits at the surgical neck of the affected arm. Remember, you have to look at the affected arm and bring with the other arm up. We did this in lab Tuesday. You'll do it in lab today. Remind me, this is your favorite. All right, and what method was it? Lawrence, all right. And the rest, we have two options here. We can do what? For respiration. A breathing technique using a, give me the two variables. Okay, so that's fine. That equals 80, right? That equals 80, but I was really just wanting what? Low, MA, long time. But your example was correct. That's perfect. All right, good job. All right. Where's your card? I can't see it. Hannah. Hannah's are sitting in, all right, Hannah. Up front, Hannah. What we got?
That's an AP humerus.
Okay, it's an AP humerus. And why do you say it's an AP humerus?
Because it goes all the way down to the elbow, and the humerus is like this. The microcus of it. Because it goes all the way down to the
Well, so does the lateral. Lateral humerus shows the whole humerus.
Oh, the epicondyle.
There you go. So we see the two epicondyles, and they are what?
Parallel to the IR.
Do you get this? Who said perpendicular? Be careful with that. That is the key to this. So take your time and really look at that stuff. Yes. Kind of looks like a little AP elbow with a little turn to it, a little pull to the forearm. All right, very good. Lillian, go. Projection and area of interest. AP, clavicle, which is it?
It's a AP axis
Okay, and why do you say that?
because it's horizontal and there's not so much rib above it.
Yeah, are you getting this? All right. All right, review question. Lateral, what do we got here? Saul.
Is it the lateral scapula shoulder body?
Because look where your arm's at, and it's pulled over the what? Over the processes, the top part of the scapula. So this is the only thing that's cleared. Absolutely. All right. Who hasn't had one? Who? Who?
Three-fourths.
Yeah, they don't like me to call on them. I've heard what they were saying, that they're gonna tell me they don't know. I do have y'all's name if y'all wanna play along. I don't have that many left. Be prepared Tuesday. I will call on you guys. It'll be all on you guys. I didn't even know this was in here. Sydney. Hmm. What'd you say? What do y'all say? So it's AP shoulder width. Because what is this? Greater tubercle? Everybody with that? Everybody agree? Ms. Shelton, you agree? You see this big bump?
Yeah.
And what is that?
The greatest.
There you go. All right. All right. So what do we have here? I can't think of your name. I'm going blank. Lindsay. So we're going to crosshair it. We're going to hit right there. It's about, what, 2 inches below the coracoid. Arms pulled out. AP scapula. All right. What time is it? We got a ways. All right. I would call. Has everybody had one here? Danielle. I'm sorry, forgot about you there. All right.
AP clavicle.
AP clavicle, definitely not a shoulder, huh? Can't see the humeral head clearly there. So that's the only one, and it does have just a little bit of angulation here, and you got a lot more of it up here, a lot more of the chest above the clavicle. All right. All right. Who has Maya? Have you Zoria? Have you had one?
I haven't.
All right.
It's an achy shoulder.
Mm-hmm.
External.
What is this big bump? What do y'all think? I would say external. AP shoulder external. All right. What is the anatomy labeled with the arrow? All right. Projection and anatomy. What is the projection? We see the what? We see the Y. We notice that the humerus is completely superimposed by it. So that can't be a lateral scapula because we would have had that humerus moved out of the way. So we know this is a scapula Y for
Glenoid cavity.
scapula Y for shoulder joint dislocation because the what? Relationship of the humerus and the glenoid cavity, it doesn't change. So the placement of the arm is irrelevant. If this was a lateral scapula, it would fail. And for the processes, you would see the arm in a more of a what? Remember, it's going to be popped out for the processes. It's going to be like this for the body. So when you're seeing that, this is a perfect scapula Y. This is how I like to do mine. I like for the humerus to come superimposed over the body. Just think it's pretty. But what we're looking for is what? The humeral head being dislocated. What's the most common dislocation? Why? Because you can't control your backward falls. All right. Projection and anatomy. All right. What do you think? What's this? That's that triangular looking thing, so that's only created with a internal, so it's an AP shoulder width. It's, all right. Oh my goodness. Presley. Projection. What's the projection in the anatomy? All right. That was it. All right, let me stop that recording. Shreveport, I do have another huge image analysis. A critique will go over